this video, I'm going to be discussing high blood pressure, its effects on our bodies, and what you can do to help lower your blood pressure naturally by changing these lifestyle habits. Hello superhumans, my name is Dr. Tessa Spencer. I'm a licensed and practicing pharmacist as well as a certified personal trainer and nutrition coach. And my method for achieving success in my clients is simple. I use evidence-based nutrition, exercise, superfoods, and supplements to optimize your health. And if you're ready to hear how I can help you in your health journey, make sure to book a free wellness consultation with me using the link in my description below. You can also apply to be a part of my 12-week personalized heart health coaching program and start transforming your health today. And if this video helps you in any way, make sure to please subscribe to my channel as it really supports me and my mission to help you, and share this video with anyone who you might feel could be helped with this information. Alright, so let's get into a little bit of the background knowledge. Blood pressure is the pressure of the blood pushing against the walls of our arteries. Blood pressure is determined by both the amount of blood that your heart pumps and the amount of resistance your blood kind of has to the flow in your arteries. The more blood your heart is pumping and the narrower your arteries, the higher your blood pressure is going to be. So blood pressure really comes down to two numbers. The first, or the top number, is the systolic pressure, measuring the pressure in your arteries when your heart beats. The second, or the bottom number, is the diastolic pressure, and this is measuring the pressure in your arteries between heartbeats. If the measurement reads 120 systolic and 80 diastolic, you would say 120 over 80, or you would write it in 120-80 millimeters of mercury, which is how blood pressure is measured. While your blood pressure normally rises and falls throughout the day, chronically uncontrolled high blood pressure, also known as hypertension, which is the common condition in which long-term force of the blood on your arteries is high enough that it may cause health problems such as heart disease, stroke, or experiencing a heart attack. Now, there are two different types of high blood pressure. For most adults, there's no identical cause of high blood pressure. This type of blood pressure is called primary hypertension, and it tends to develop gradually over many years of our life, mostly due to risk factors which include age. So the risk of high blood pressure increases as you age. The second risk factor is being overweight or obese. So the more you weigh, the more blood you need to kind of supply the oxygen and nutrients to your tissues. As the amount of blood flow through your blood vessels increases, so does the pressure on your artery walls, which then increases your blood pressure. Number three is not being very physically active. So people who are inactive tend to have higher heart rates. The higher your heart rate, the harder your heart must work in each contraction and pushing your blood through. That means there's more force on your arteries. Then causes a higher blood pressure. The next is using tobacco. Now, not only does smoking or chewing tobacco immediately raise your blood pressure temporarily, but also chemicals in the tobacco can damage the lining of your artery walls. This can cause your arteries to narrow and increase your risk of heart disease. Secondhand smoke can also increase your risk of heart disease as well. The next is too much salt or sodium in your diet. So too much sodium in your diet can cause your body to retain fluid, which then increases your blood pressure. Having too little potassium in your diet can also raise your blood pressure. Potassium helps balance the amounts of sodium in your cells. The proper balance of potassium is critical for good heart health. The next is drinking too much alcohol. So over time, heavy drinking can damage your heart. Having more than one drink a day for women or more than 2 drinks a day for men can affect your blood pressure. One drink equals about 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of 80 proof liquor. The last one is stress. Having high levels of chronic stress can lead to a temporary increase in blood pressure. Stress-related habits such as eating more, using tobacco, or drinking alcohol can also further increase your blood pressure. Now, the second type of blood pressure is caused by an underlying condition. This type of blood pressure is called secondary hypertension, and this tends to appear suddenly or cause a higher blood pressure than primary hypertension does. Various conditions, medications can lead to secondary hypertension, including obstructive sleep apneas, kidney disease, adrenal gland tumors, thyroid problems, and taking certain medications such as birth control pills oils, cold remedies, decongestants, over-the-counter pain relievers can also increase your blood pressure. Also, taking illegal drugs or illicit drugs such as cocaine and amphetamines can also have an effect on your blood pressure. Most people with chronically high blood pressure don't really have any symptoms or signs at all. The excessive pressure on your artery walls caused by high blood pressure can damage your blood vessels as well as your organs. The higher your blood pressure, the longer it goes uncontrolled, the greater the damage. Uncontrolled high blood pressure can lead to complications including heart attack or strokes, aneurysm, heart failure, weakened and narrow blood vessels in your kidneys, vision loss, metabolic syndrome, and trouble with memory and understanding. This is why home monitoring is an important and vital way to confirm if you have high blood pressure, and also to check if your blood pressure treatment is working to see if your high blood pressure is getting better or worse. Home blood pressure monitors are widely available, they're inexpensive, and you don't need a prescription to buy one. However, make sure that you use a validated device and check that the cuff fits. I have a link below in my description on kind of the best blood pressure cuffs that are out there on the market right now. Also important to note that devices measuring your blood pressure using your finger aren't really recommended anymore by the American Heart Association because they can provide less reliable results. Your blood pressure generally should be measured in both arms to determine if there is a difference. I'll also link below a little graphic that shows you exactly how to measure your blood pressures at home. Now, blood pressures fall into several different categories. Your blood pressure is normal if it is below 120/80. Elevated blood pressure is considered a systolic blood pressure of 120 to 129. Stage 1 hypertension is the systolic pressure ranging from 130 to 139, and a diastolic pressure ranging from 80 to 89. Stage 2 hypertension, which is the more severe hypertension, is a systolic pressure of 140 or higher than that, or diastolic pressure of 90 or higher than that. Now, a hypertension crisis is a blood pressure measurement greater than 180/120. This is an emergency situation and it really requires urgent medical care. If you do get this result when you're monitoring your blood pressure at home, stay calm, wait about 5 minutes, and then re-measure your blood pressure. If your blood pressure is still that high, make sure to contact your doctor immediately. And if you also have chest pain, vision problems, numbness or weakness, difficulty breathing, or any signs and symptoms of a stroke or heart attack, make sure to call 911 immediately. Now, I know I just went over a lot of numbers and scary situations, but the great thing about high blood pressure is that lifestyle changes can really help you control and prevent or even reduce high blood pressure, even if you're taking blood pressure medication. Now, here are some non-specific lifestyle changes that I generally try to incorporate into the lives of the clients that I work with. Number 1 is eating a heart-healthy diet. So try the dietary approaches to stop hypertension. It's also known as the DASH diet, which emphasizes fruits, vegetables, whole grains, poultry, fish, low-fat dairy foods, and things like that. Get plenty of potassium in potassium-rich fruits and vegetables, as well as eating less saturated fat and trans fat. I personally recommend a whole foods plant-based diet, as that has been shown time and time again to be kind of the best dietary practices if you're trying to reverse, prevent, or control high blood pressure. But I know that eating plant-based isn't necessarily realistic for everybody, and that's okay. Just making sure that you're really increasing your intake of fruits and vegetables, legumes, nuts, seeds. The next is decreasing salt in your diet. Aim to limit sodium less than about 2,300 milligrams a day or less. However, a lower sodium intake of about 1,500 milligrams a day or less is kind of ideal for most adults. While you can reduce the amount of salt that you eat by, putting down the salt shaker, you can generally pay attention to the amount of salts that is in processed foods that you eat, such as canned soups or frozen dinners. The next is maintaining a healthy weight. So keeping a healthy weight or losing weight if you're overweight or obese can really help you control your high blood pressure and lower your risk of heart health problems. The next is increasing your physical activity. So regular physical activities can help lower your blood pressure, manage stress, can keep your weight under control, and you reduce your risk of many different health conditions, not just high blood pressure. Consistent, moderate to high intensity workouts can really help lower your blood pressure readings by about 11 points, and the bottom number by about 5 points. Aim for at least 150 minutes a week of moderate aerobic activity or 75 minutes a week of vigorous vigorous activity or a combination of kind of moderate and vigorous activity. And try to aim to do muscle strengthening exercises at least 2 days a week, trying to incorporate all of the major muscle groups. The next is limiting alcohol and also quitting smoking or the use of tobacco products. The next is kind of also a given: manage your stress. Reducing stress as much as possible by practicing healthy coping techniques such as muscle relaxation, deep breathing, or mindfulness. The next is monitoring your blood pressure at home. So blood pressure monitoring, as I mentioned before, allows you to keep a daily log of your blood pressure measurements, and your doctor can help review that information to determine if your medications or your current treatment strategies is working or if it's having complications. Now, I know I just threw a ton of information your way, and everything that I've gone over, you might be feeling a little overwhelmed, and that is perfectly normal. I tell you these implications and these problems of high blood pressure so you understand the severity of that condition and how it can implement your health, because I want to motivate you to take your health seriously and really implement change. And I'm not asking you to implement these changes overnight. Small, consistent changes are what have big impacts over time. And that is why I created my 12-week online coaching programs to really help individuals like yourself and those with all forms of heart conditions go from overweight, overwhelmed, and heavily medicated to normal weight, energized, and in full control of their condition. This step-by-step approach in improving health, decreasing stress, and gaining energy is backed with proven results. And I'm there guiding you, coaching you every step of the way, answering your questions, providing you feedback, and making sure that you're improving each and every week. So if you're ready to work with me or you have questions about my program, make sure to book that free wellness consultation with me by using that link below. If you want to learn about superfoods and supplements that have a clinical benefit that might help you and your physical health, I do offer personalized supplement protocols as well for helping people go from confused and paying too much for supplements that don't work to confident and reaching their health goals faster. And once again, if you like this video, make sure to give it a thumbs up, subscribe to my YouTube channel, and hit that bell notification as you're notified each and every time I upload a new video. And make sure to share this video. Share it with anyone who you think could really benefit from hearing this information or being a part of a program like mine. Finally, if you have any questions whatsoever, make sure to put them below in the comments or send me an email at hello@thesuperfoodpharmacist.com. Hopefully you've enjoyed this blood pressure introduction video, and I really look forward to seeing you in my next video. But until then, keep striving and keep living your worth.